Welcome everyone. We're going to get started here in just a moment. We're going to let folks join the webinar. Thank you all for joining us today. All righty, good afternoon and thanks for joining us. Welcome to ITUP's LA Health Collaborative, addressing broadband as a social driver of health. My name is Emily Cosillo and I am the Director of Programs for Insure the Uninsured Project. Before the session begins, I have some important housekeeping notes for you. First off, this webinar is being recorded and will be available on the ITUP LA Health Collaborative webpage after the event. Attendees can listen in to this webinar through their computers or by dialing in using the number and passcode provided by the Zoom software. We also welcome you to utilize the closed captioning function. Just click on the CC button at the bottom of your screen to enable the live transcription feature. Today's webinar will run approximately 2 hours and we'll have 2 main panels, each followed by a question and answer session. If you have questions during the webinar, you don't have to wait until the end of each panel or presentation to submit. We encourage you to submit your questions using the question and answer panel, which you can also find at the bottom of your screen. When submitting a question, please indicate if it's directed at a specific speaker. We will answer as many questions as we can throughout today's webinar. Also located at the bottom of your screen is the chat panel. Please feel free to use this chat function to say hello or chat with other attendees. We will be posting relevant information and links throughout the webinar in this place. And now I will hand it over to ITUP's Executive Director, Katie Hydorn, to get us started today. Katie?
Great. Thanks so much, Emily, and welcome everybody. Thanks so much for joining us today. I'm really excited to jump into our first panel, but before we begin, I just wanted to give a bit of background on Insure the Uninsured Project for you, to any of those of you who might be new. Our mission is to promote innovative and workable policy solutions that expand healthcare access and improve the health of all Californians. And we implement our mission through policy-focused research and broad-based stakeholder engagement. We believe that all Californians should have a fair opportunity to live their healthiest lives. And our values are that we seek a health system that is universal, equitable, accessible, effective, and affordable. We are a 25-year-old health policy nonprofit and convener. And as such, we've evolved over time from not just insuring the uninsured, but also making sure that that coverage is actually meaningful and today, and that includes social determinants of health, and really in a post-coverage, sort of post-Affordable Care Act and post-COVID environment, that also includes bridging this digital divide. So I'm really excited today to bring this to you. We've talked about virtual care, we've talked about broadband and telehealth at our annual conference that we host every February, but we're really excited to do a deep dive in LA County today. And I'm very excited to have not only healthcare entities speaking about their work in telehealth and virtual care and the need to improve connectivity, but also then to welcome some broadband experts to our LA Health Collaborative, who are not healthcare experts, but they're experts in another area. And so we can learn what they're working on in your community today and how you can actually engage. Before we start though, we actually wanted to do something a little new for us in this group. We wanted to get all of the audience to tell us how much you actually know about the broadband work that's going on in LA County today. So I'm going to invite Emily to put up a quick poll. It would really help us if you'd fill it out, and we can see what that all looks like. Thank you. This is also a test of your digital literacy, just to be very clear, which is one leg of our digital equity stool. We'll give it just another 30 seconds. Thank you all. All right, let's close that poll. Perfect. Thank you so much. All right. So with that, we're going to jump into our first panel of the day, and we wanted to make sure we highlighted a few of your colleagues in the LA County health world who are doing work in this very area today. So it's just my pleasure to welcome these 4 incredible people and organizations to our conversation today. I'm going to ask them to introduce themselves, their organization. I'm going to take probably 3 to 5 minutes to actually talk and do a little bit of a deep dive into the work that they're doing in broadband connectivity, virtual care, and telehealth in LA County. So I'm going to start with Charmaine. Charmaine, please go ahead.
Thank you so much, and thank you for the invitation to be here. I'm really excited to share, as well as to hear from my other colleagues in this space. And so thank you for connecting us. So my name is Charmaine Dorsey, and I am a licensed clinical social worker. I serve in the capacity of Director of Patient and Social Support Services with our Los Angeles County Department of Health Services. And I've been in health services for about 21 years. And so really what I would offer in this space and kind of part of my role is really to help look across our system in the continuum. So emergency medicine, inpatient and outpatient services, and then thinking about the best way to both identify, so from a screening perspective, some of the needs that our communities are facing in the realm of social needs, mental health, substance use, et cetera, physical health, and how we tangibly then address that. And how that's related then to our conversation today is that as we're screening for and trying to understand what the needs are, there have certainly been things that have been identified related to digital divide and the importance of digital inclusion. So from a perspective of both the actual device to the broadband service, and then also that digital literacy piece. And so we've seen that it has existed. I would say that as a result of the pandemic, the issues have certainly been highlighted, which in some way I can appreciate, because I think that's what then brings us to these kinds of conversations and then potential solutions to be able to address that, because we have certainly enhanced and want to continue to do so in our video visits, our telemedicine efforts, as well as just addressing any number of the social needs that we see. So I'll be able to share a little bit more as we dive in a bit in terms of some specific examples, but very thankful to be here with you all and have served in our kind of county-wide digital divide committee. So thanks so much.
Wonderful. Thanks, Charmaine. And I'm sure we're going to want to hear a little bit more about that as we get a little deeper. Thank you. I'm going to go to Joanne next. Please go ahead, Joanne.
Thanks, Katie. And again, I'll echo Charmaine and say thank you for inviting us to be part of this conversation today. My name is Joanne Priest. I'm the Director of Government and External Affairs with the Community Clinic Association of Los Angeles County. I think many folks on the line probably familiar with us, but in case folks are not, we do represent 65 community health center organizations across LA County. So together they operate over 350 sites serving 1.7 million patients. So telehealth has been top of mind for, as you can imagine, and have probably heard us talk about for the past 2 years, 2+ years at this point in time. So again, really happy to be part of this conversation and really looking at, broadband access, digital equity, digital literacy, because this is, of course, the next step in our journey. So pleased to be here. I think as a little bit of background on sort of how this intersects with the work of CCA-LAC. Probably no secret that clinics had to pivot really quickly to telehealth in the early days of the pandemic. So we spent a lot of 2020, many folks at our organization, really supporting clinics with how they do that. Implementation, we ran a telehealth assistance program for our members. We did some remote patient monitoring device purchasing for our members, and really just helping clinics get it off the ground, probably far faster than they ever dreamed they would with regard to telehealth. Throughout it all, I think there was that realization, it became very apparent very quickly that a sizable portion of our patients couldn't access the telehealth, the streaming and the video component of telehealth. And so there's always been this narrative about the importance of audio visits, and that clinics were relying really heavily on audio visits to serve their patients during that time when, we were told to stay home, and then a lot of folks just wanted to keep staying home. And so that importance of maintaining access to the audio care in addition to video became such an important component for us because of what we're here to talk about today. Like, the broadband access isn't there, the devices aren't there, the digital literacy isn't necessarily there for everyone that the clinics are serving. So I think it's been two-pronged for us. It's been a lot on the implementation side, sort of the nuts and bolts operationally, how you do this in a clinic and how you get good at doing this in a clinic. But we also have done a lot of work in the policy space throughout 2020. It was really, initially, federally qualified health centers, we have, crazy payment rules and mechanisms. And it was about how do we fit telehealth into that? Just getting the necessary approvals and flexibilities to even do telehealth and be reimbursed for telehealth was sort of the first phase of the policy work. And then once we discovered that, hey, it works and hey, patients really like this, it became apparent we needed to continue that flexibility. And so then the policy and advocacy work continued to how do we keep this? If when this pandemic ends, how do we make sure patients retain access to getting care in this way and all of the other barriers that it helps overcome for patients? It's just so nice to be able to have a phone call or a video visit with your doctor when that's, an appropriate way of getting care for whatever your situation is. So we've done a lot of work around maintaining that flexibility and, fingers crossed. I know we're all watching closely a Medi-Cal policy related to telehealth. Looks okay. I don't want to get ahead of myself, but, just like this, I think we're looking okay, but we've definitely pivoted to this issue of the digital divide lately. Our HIT team recently created a really comprehensive toolkit alongside CMA, and it's how to sort of mitigate, I'll call it, the digital divide. It's the various programs and services that are available for folks. So that work I think of as sort of mitigating, but we need to solve it. And so that's why we're really glad to be here today and to be part of this conversation with all of you.
Joanne, thank you so much. And I appreciate that you highlighted all the work that the clinics in LA have done in a very short amount of time, and that, yeah, it's 2+ years and we're into, now we've done this, what are the next steps? And I think just one thing I want to highlight before we let Stephanie talk about this, because I think this is going to dovetail nicely. We have money now. The state is paying in a big way for telehealth, like it never did before, not only particularly in the FQHC space, the clinic space, but also in the rest of health. It's really exciting. But on the broadband side, the state has also put literally billions of dollars, $6 billion into building broadband infrastructure across the state. So we'll drop a couple links in case folks want to pay attention to what's going on at the state level with that as well. There are a few places to engage, but just wanted to highlight that the money's there and the will is there. And so we actually can have this conversation now. It's really exciting. So Stephanie, please go ahead and chat with us about what the health plans are doing.
Yeah. So thank you for having me, Katie, and just echoing, very excited about that broadband funding. That's something we've definitely been very supportive of. So I'm Stephanie Landrum Hall. I'm the Senior Manager of Community Grants and Public Affairs at HealthNet. And I was asked to be here to really talk about our HealthNet grant that we launched in the spring of 2020. So our world was changing. We collaborated with the California Department of Public Health to bring telehealth to our underserved patients and members. And we granted 138 Medi-Cal providers with approximately $13.4 million in grant funding. Really, we found that 20% of these grantees reported that they had really no access to telehealth services prior to this funding. And on average, they increased their telehealth visits from 2% up to 45%. So that represents a 20-fold increase. So we're pretty excited about that. So we also just recently sunsetted this grant program. It was a year-long program, and we contracted with partner and company Community Research to really highlight the key findings from these 138 providers. And as it's probably no surprise to everyone, we were able to see that preventative care went up. 31% of the providers were able to conduct routine checkups or wellness checks for their patients. Health screenings definitely went up by 42%. They identified telehealth as an important tool for these telehealth screenings. Health education, 17% reported that they were able to increase health education, nutrition, physical activity, counseling, and diabetes education and smoking cessation. And then mental health, 16% had success providing counseling and other mental health services. But really echoing what my other colleagues are saying here, there was, of course, also challenges that were reported out. 82% of providers said that patients had problems accessing technology and internet. 24% of providers had problems learning the new technology. And then what we really heard was that 12% of the patients preferred in-person care. There were privacy concerns and really that lack of access that we're going to be talking about today. So we are really committed to continuing telehealth efforts, both with continuing different facets of this program, and then our other colleagues in our telehealth services program and HealthNet have a number of other programs that they're working on as well. Also, our government relations folks have closely been watching all of the different bills that are coming to fruition. So just really supportive of that as well. So happy to be here and really to dive into all of this. Thank you.
Thank you so much for that, Stephanie. And as you've mentioned, I know what we do at the LA Health Collaborative is have this really local look, but also bring in some of the state work. So if anyone wants more information on the state stuff, we just dropped in the report from HealthNet into the chat. There are a few ITUP just broadband 101 resources here, and there are places for you to engage as well and learn more about the state efforts. And I know our colleagues on the next panel will also talk about a couple of bills that they are supporting and running in the state legislature this year to make sure that broadband is equitable. So if you're interested in those as well, we're happy to connect you to them if that's something that interests you or your organization. So with that, I'm really excited to go to Dr. Nana. She does incredible work on the ground with the most vulnerable residents of LA County. So can't wait to hear her talk about all of her work as well. Dr. Nana, please go ahead.
Hi, thank you. Thank you so much for being inviting me to be a part of this. I come to know ITUP from this incredible roller coaster of a season, and it has been one of the joys of the pandemic to find your tribe. My name is Dr. Nana Fomanin. I am an emergency physician, public health practitioner, and disaster medicine specialist, and recent social entrepreneur. I am one of the co-founders of Shared Harvest and the My COVID MD platform. Its focus really is on elevating the culture of volunteering while tackling one crisis, the student loan debt crisis, through compassion, wellness, service, and relief. And then during the pandemic, we realized that the second crisis we were dealing with is the healthcare disparities. The COVID-19 pandemic, as everyone knows, had an overrepresentation of Black and Latino families in the hospital. 33% of hospitalizations were of Black families, although only they represented 18% of the population. So we were very keen, and it's very personal to hear, the seance that when America catches a cold, Black America catches pneumonia. And as a physician and seeing family members and loved ones also impacted by this issue, we wanted to get out into the community. In our hospitals, we were adopting telehealth, but I knew in our communities, in my neighborhood, they were not adopting telehealth. 30 million people didn't have their broadband access in America. And many of the digital solutions that were coming out to play were going to further disenfranchise a larger community. They had no access, no equipment, can't afford it, too slow broadband. So it was very important for Shared Harvest to get in the game of understanding the digital and wealth gap and knowing that there was no turning back in telehealth. So how do we create a more inclusive space? Connectivity became the new social determinant of health. And so our solution was 3 solutions in one. We created a free public telehealth network platform, and we brought telehealth to the community. We actually physically brought the devices and created drive-through pop-up telehealth clinics to see what were the problems and pain points for the community members that were trying to engage in telehealth. And then after that, we made sure we kept it very low tech, high impact, and human. We started doing healthcare navigation through our Community Health Partners Network. And those are individuals, or volunteer providers, clinicians, therapists, family medicine doctors who are helping to navigate this tumultuous healthcare system for those who were underinsured or not insured at all. And then what we wanted to do beyond that is create clinical support hubs where physicians could actually come into communities that already were resource deprived for health establishments and meet the residents there at those facilities. At those facilities, not only did we provide clinical care, but we also had an opportunity to get into the weeds of how to manage this telehealth interface and understand better pain points. That informed us and how we developed and built out the telehealth platform. And then we understood that we had an incredible voice in policy. And that's why we started working on the digital divide campaigns and providing independent survey research based on our constituents. Shared Harvest is provide service to over 10,000 people in South LA in specifically low resource hot zones where the percentage of COVID cases were highest. So although our numbers weren't huge, the concentration, the quality of data that we were collecting because of the communities that we were right on the ground with showed a true impact and was a real representation of the digital divide. And so moving forward, we continue to be part of that space, and we're bringing young adults and graduate students in through our practicum curriculum. And then we're expanding our telehealth component to include a larger initiative called Project Recess, which is focused on the mental health and well-being of providers of color who have been providing these frontline medical services. So I'm excited to talk to you guys more about what we're doing and see how other people can get involved.
Wonderful. Thank you so much. And all of your incredible work reaching out directly to people where they are. I think several of you talked about that, and Dr. Nana, you're doing that. Has that changed? I feel like that's one of the big gifts of the pandemic and of telehealth, is that we can actually use it to bring tablets, et cetera, to people. In each of your work, are you all collecting data on that at all? I think that was one of the big aha moments when we came to this broadband conversation. Our broadband policy colleagues said, "How are you not collecting data on connectivity?" And I said, "Wow, this is this is really new." As you all said, this just, I think, really became in a big way a social driver of health. So we don't have a lot of data, but has that changed? Have you changed the way you're meeting people and changed the way you're asking people about how they want to get their care and where they want to get their care? Dr. Nana, I know through our work with the California Community Foundation Digital Equity Initiative, which you all will hear about on the next panel, that's how we met. I know you've been collecting some of that data, so I'll start with you.
Yes, it's very important to collect this data, because especially to be able to collect the data one-on-one, right? Because what we learned, and our practicum students learned the hard way, is you can ask one question another way, but you're not going to get all the answer pieces. And so one of the things that we were very excited about is really starting out with what we call a very shallow 5-point survey, and then went into a more in-depth survey analysis about connectivity, everything from who's your service provider and what do you consider connectivity is. Some people consider connectivity as, I don't have broadband, and some people have no idea what broadband is. Like, I don't have enough data on my cell phone. That's lack of connectivity. The other things that we started finding when we went in depth to actually start focus groups is realizing which hotspots and what they were the different things that communities were trying to do to get around the challenges of the hotspots. People making, what we call second level economics, money on the side to be the hotspot for the community. I mean, some of this stuff was just amazing. And I have an immigrant background, so I'm from Ghana, West Africa. And a lot of the scenarios that we were seeing in Nickerson Gardens was very parallel to what I was seeing in the village in Ghana when I was growing up, where there was one telephone household. And in order to talk to anybody in the overseas, everybody knew to go to that house, right? So it just, it just took me back for me, like we are in the 21st century, and we are dealing with this in the middle of a developed country pandemic, and we are still dealing with households who are having to figure out how to mobilize just to be connected. And so when you're talking about the vulnerability of health too, on top of that, no one's going to want to deal with these clunky barriers. And so we thought it was just as important as we were building the tech and understanding and being informed by our residents, that we are also creating this space that they can literally choose healthcare as they want it. whether it's by the phone, or showing up at the local church that turned into a pop-up clinic, or showing up at the grocery store that turned up into a pop-up clinic. But we knew we had to stay connected, and connected was the human connection and what we call empathy-driven technology.
Amazing. Wow. And thank you so much for that parallel story. That just blows my mind to hear that. So thank you for that. It's I think that parallel is so important. I think we think of connectivity and broadband as a rural or underdeveloped issue, yet in the heart of LA, one of the most urban areas in the country, we're hearing that this is still an issue. So thank you for that. I think I'm going to go to Joanne next, because I know you all really are experimenting with virtual care and ongoing monitoring and devices. So I'd love your thoughts and some of the work that you've done on that.
Yeah, I think I was just thinking about the data question. I did check in with our HIT team on that. And I think we're in the early stages. I think it's like, yes, the light bulb has gone on, like we should collect that data on, the patients and their connectivity. But my sense is it's in the early stages. So the will is there, but I think, yeah, some of the items that were being raised around just like how you ask the question and what word are you using, and is everyone interpreting things the same way as far as what we even mean when we say connectivity. Yeah, a lot of questions there that are really interesting. I've seen some, like I saw a survey, a clinic has like an assessment tool, so it's happening. I don't know if my colleagues are on the line and have anything to offer via the chat. We could have an engaged conversation in the chat. But I think it definitely feels early. I saw a screening tool and it was a few questions and it resulted in a score, which made it into the EHR. But the questions around how meaningful is the score? What are staff able to do? Is it actionable? And does it tell you much if they got a 3 on the connectivity survey? I had a lot of questions around what does that tell you about this patient's ability, willingness, and will to have a telehealth visit, conduct a telehealth visit. I think there's a lot of, I'll call it fine tuning there. I think we did this all so quickly in the clinic space with regard to implementing telehealth, that's definitely a piece of the puzzle that, there's probably a lot of work left to do around that data. I think I would be fascinated to know. Another piece we've done that I alluded to previously was around creating that toolkit with CMA, and it's really comprehensive and it's got all these tools and resources. This program is available if you meet these criteria, and this program, and here's how you can get a laptop or a phone or low-cost internet. I mean, there's far more in there than I ever dreamed even existed. So to see it all in one place is great, but I have to imagine using it is probably daunting. Which program actually fits for which patient, and then you can't just really give them a list, right? Here's a list of 100 programs. Have fun. I know what I would do with that. Sorry, I got other things to do. I'm busy. So just thinking about what it really takes to in a clinic, in the clinic setting, which staff are involved and who's really walking patients through that and really trying to figure out what their needs really are, and then making sure you can see it through, right? A to Z. You don't want to ask a question and determine a need if you don't have a solution to offer. So I think that's a really important component as well. And so it feels like baby steps. It feels like we're going there, but yeah, I think we might have implemented telehealth, but we've got a lot of work left to do to make it actually a real option for so many of our patients.
Absolutely. Thanks, Joanne. And I think what's so powerful about this digital equity initiative that CCF is creating, that CCA, LAC, and Shared Harvest and ITUP are part of, and we would, is that it's cross-sectoral in nature, so that when you do identify a need in the community, when you're at a pop-up clinic or in a clinic, even within an office, you can say, here is, you can actually make those referrals just like you'd make another, a behavioral health referral or a specialty referral to people who actually have warehouses with refurbished devices that can be made available at a lower cost. So I think that cross partnership is really exciting. So definitely more on that, Joanne. Thanks for sharing. Let's see, I'd love to go to Charmaine next and hear what the county is doing, because you all are connected with your inter-county departments, but also a provider of healthcare. So I'm sure you have lots of thoughts on this.
Yeah, absolutely. And you'll hear from an esteemed colleague in the second panel related to a lot of the what I would say are probably more robust efforts related to our data capture and kind of really having a good sense of what's happening across. What was really such a wonderful opportunity is that our county departments came together to share, because similar to what we've talked about here, it's and thank you for sharing that toolkit. It's how do we even know what's available? How do we know to connect folks, right? And so in our health setting, yes, the video visits for telehealth were important. We certainly had to do some, there were some grants, right, that we applied for. Grants are not sustainable. They're wonderful to like help get us going. They're not sustainable, and how we can leverage them can be very specific. So in some of them, we weren't able to provide devices. It helped to fund other things, and so there's sometimes this mismatch of kind of what the needs are and then what we can like piece together. And so the county group was really helpful to say, oh, my colleagues in Parks and Rec, like that could be like, as you know, to the point about if I'm screening for something or I'm asking the question, how can I tangibly address it? Then our teams then have some information about, well, we could maybe connect, maybe Parks and Rec is the way to go, or maybe the, library. I mean, then we start to understand a little bit more comprehensively what's available. I would say within the health system, we certainly are, it's crucial and pivotal to identify. We also need our partners, because we can't be the solvers of all the things. And so, being able to leverage community-based organizations, our other county departments, so that we have something to link folks to. In regards to the data question, certainly you're saying like it's new. I mean, we're sort of at the beginning of that, because it's even thinking about the standardized way to ask the question. We have an assessment that we do with folks, and it does come up because even prior to the pandemic, for us being able to connect with our patients outside of the hospital is key. And that is difficult if there is not a telephone or some device, right? And so those community visits are really helpful with some of our community health workers that are able to go in the field. But even that, right? Or we have an Uber Lyft contract, which is wonderful to be able to provide transportation. Well, guess what? You need a device to be able to get, right? So we have this really wonderful thing that we think we solved for, which we did, and it is a great resource. It's just thinking about then like all those pieces that need to be connected for somebody to actually even leverage it. We have the our health portal, which is amazing, and so they are able to capture some data on who's tapping into and utilizing that. Of course, that requires them to have services, and we partnered with folks like our HealthNet health plan partner, who was able to provide some phones, and for some time some service as well, and paid for some service, which was an amazing help. Again, it's time limited. So I think it's thinking about, and so I share all that to say, yes, data is important. I think we really also need to think about, in order to capture good data, some sustainable processes of both the screening and then the addressing of these, to really be able to have robust data to share.
Absolutely. Thank you so much, Charmaine. That's all incredible work. And I heard you mention community health workers, so I'm going to come back to that in a little bit as well. Stephanie, why don't you go ahead? I'm sure you have lots of thoughts after listening to your colleagues.
Yeah, and Charmaine, thank you for highlighting the cell phone distribution. So that's another program that we did. We gave out approximately $500,000 worth of cell phones and broadband access to different providers and to members throughout the area. And this would be throughout the state of California, not necessarily specific to LA, but obviously a large part of our membership is based in LA. So very supportive of that. But yeah, I mean, from a data collection perspective, we're doing that on multiple fronts, but I agree with my colleagues, it's in the infancy stages. Our report that I mentioned earlier, we were able to survey those 138 grantees, and then they were likewise able to talk to their respective patients and get their data information. But then on our telehealth services department, they're coming out with a new innovative initiative. So we have Babylon Health, which is an app, because as we know, having a cell phone is going to have much more accessibility to populations than, say, your home computer. And so this mobile app uses AI and then a sophisticated symptom tracker, and so that members are able to access that immediately from their fingertips. We're also have our live chat through our membership platform to address COVID-19 concerns. We have a 24/7 phone line in case there are behavioral health concerns that members can call into. So really attacking this from multiple fronts, and then of course collecting data on all of these different sources to really see what's resonating, what's working, and what could we be improving.
Wonderful, Stephanie, thanks so much for lifting up a little bit what the I'd say like health systems infrastructure is actually doing as well, and what HealthNet has done through all of this. I see a question in the chat, and at this point, we have some questions that we're going to walk through. But as I think someone invited, please feel free to utilize the chat. We love your thoughts. We love your concerns. If you're hearing anything, please feel free. I love that we can have a bit of an interactive opportunity here as well. And if you have questions, you can either put them in the chat or you can put them in the Q&A box as well. We'll be monitoring both of those. So if there's a question in the chat that says, with patients struggling to use technology, are there any programs in the works for the community to utilize digital navigators? Aisha, thank you so much for that big thumbs up. I'm gonna let the panel respond, but you are actually gonna hear a little bit more about that from the non-health perspective from Selwyn Hollins, who's one of our speakers from LA County Internal Services Department and their pilot program in the next panel. But I imagine our health stakeholders here also have some thoughts about that. So Dr. Nana, I saw some thumbs up, so why don't you go ahead and respond?
Yeah, speaking to the infrastructure, we have the infrastructure and the equipment. The data problem, as I had mentioned earlier in the chat, is an issue about capacity building. Shared Harvest's approach to capacity building was that we weren't hiring physicians to be on the other side of telehealth. We were creating a task force of volunteers who cared about health equity and the digital divide. And they were volunteering their times in large amount, but we were rewarding them understanding the limitations that this workforce, the medical pipeline had. And one of the biggest crises for them was student loan debt. So people were getting real-time debt relief against the volunteer hours and work that they were doing in the community. This allowed us to expand our capacity to do the type of work that we were talking about. So we had a whole telehealth ambassador team that were at the clinical pop-ups where we sent the link for the telehealth so people would be prepared. When we got to the site, they didn't set it up right. They couldn't figure out. Quick, that's no problem. We have 15 telehealth ambassadors. Every single car had their own person and they were going through where the hiccups are. So then we went back and said, what was the glitch? The glitch was they didn't even know this was the right button, or this person didn't want to be on video. She wanted to be on audio, couldn't figure out how to do that. So those things where the human conversation and happening in real time helped us inform how we followed up. And another thing that I wanted just to bring up was vSafe. vSafe was an important database that the federal government was using to collect data on results, side effects for the vaccine. And many of communities of color were not putting their data in the vSafe. And this is something that we were going to use to decide if, vaccines were safe. And so Shared Harvest intervened with our approach to, again, a very low tech, high touch approach, started asking the vSafe questions in we call Be Safe Together. And so we would literally go through that list. We also would do the phone call banks and do that and call through lists. So we were able to then provide an assistance to load up to 750 residents who would not have otherwise put in their side effects into the vSafe just through that kind of assistance. And so I think that's the level up that we say, like, we're at not at 2.0, we're at 1.5. We can't just eliminate the human factor in this tech. Tech is supposed to enhance what we're doing. It's not supposed to be the center, because it could look pretty with all the bells and whistles, but if there is a communication disconnect, people are just not going to use it.
Yeah, absolutely. Thank you so much for sharing that. I appreciate just the detail that's needed that folks need to access all of this. Thanks for walking us through that. Anyone else? Charmaine, Stephanie, Joanne, anyone want to jump in on community health workers, digital navigators?
I mean, I'll just say from our perspective, I mean, we are always incredibly supportive of community health workers, promotoras, and really enhancing that navigation access. We have a number of other programs that we funded where we are working directly with really that access level and patient navigation. And so I definitely see that as future steps in moving in that direction. And then also, I mean, we've been helping directly the community health centers with the actual TA and getting everything set up from the provider perspective as well.
Yeah, and I would say, you know, we certainly, like within the clinics and within the hospitals with our team members, which are, you know, some are the community health workers, you know, trying to get folks, you know, help them get signed up with the health portal, our portal. Even helping them to sign up for an email, because you need an email to do that. So in the moment, I would say organically, but similar to what's been shared by my colleagues, it's a capacity building issue. It's not like we hired folks specifically to do that. It's just as a scope part of their role, right? But wanting folks to feel competent and confident in being able to help people. We had nursing who, when somebody was doing a video visit, in the moment, they would help them try to troubleshoot some of the like IT issues, right? As much as they could. And so I think certainly some more focused attention. I think someone's going to talk about this, but even like the train the trainer. So there's programs, and then happy to have our folks within the clinics and hospitals trained to be able in the moment to help somebody, you know, with that linkage and that service.
Yeah, whole new skill set. Joanne.
Yeah, I was just going to echo much of the same, and just I think it's happening organically with regard to who's doing that, you know, in a clinic or healthcare setting. And I suspect some folks are really good at it, and some folks are like, I can't help myself figure out my tech. So, but yeah, I think as I think about, you know, health centers and the workforce question comes up, and it is a sort of sustainability question around, I mean, is this a permanent role? I know we've had a lot of dialogue about community health workers, but what is a digital navigator? And if that's someone who's going to need to be a permanent part of the workforce, kind of what does that look like, and how is that sustainable? Just thinking from a healthcare provider's standpoint, because it does seem like as we move more towards this, you know, use of technology, that it's going to require someone who's able to provide that assistance and in-person assistance, right? Nobody wants to call the phone number and end up pushing buttons to get help with more tech. I can only imagine the nightmare there. It does feel like it's going to be a human being. And who are those human beings, and how are they trained? And how do we sustain that? You know, how is that reimbursed, I suppose, is also an important question.
Yeah, Joanne, that's a great point. Just a couple of things that are happening at the state level on that workforce piece. The governor in his proposed budget in January proposed to fund thousands of community health workers, which is really exciting. So to the extent they could be cross-trained into, you know, with some IT skill sets, or be also thought of as these, Dr. Nani said, telehealth ambassadors or digital navigators, and tapping into that really rich group of folks, whether they're promotoras or other types of community health workers that already exist, and making them sustainable is really important. So opportunities to come, hopefully at the state level, but also the Medi-Cal program that covers over 14 million people in California. They're also they just created a community health worker benefit. They're working through making sure that it actually fits the models that exist today. But, you know, but going forward, to your point on sustainability, that it sounds like this type of workforce is here to stay, and that we're making some real big investments on it for our most vulnerable Californians through those state programs. So we can provide more information on that as well. And we did drop, ITUP does have who are community health workers, what are they, and some policy considerations around that. We have a infographic fact sheet that we dropped in the chat as well. So a little bit more information on who those folks are, because they play a lot of different roles and wear a lot of different hats in the community, just as digital navigators will as well. So speaking of sustainability, where do we go from here? Are you seeing, you know, what are those big barriers now that we have some real funding in telehealth, we have some real funding in broadband? I heard some folks pull out digital navigation and sort of that digital literacy piece of the stool. I heard devices, which is the other side. Anything else? Are there particular populations of folks that you serve that you think will benefit most or could benefit from telehealth? Where do you see this going? I feel like we're just at the baseline here. Where are you all thinking? I'm going to start with Stephanie. Where's Health Net thinking of going in the future on this?
Excellent question. So, I mean, for us, it's really looking at our collaborative partners and seeing what our other fellow funders are focusing on. We're really looking at different sorts of learning hubs. I mean, I know CHCF has produced their own learning hub, and we're excited to be a part of that. But really just looking at how can we all work together to bring out these different sorts of broadband efforts, because quite frankly, we haven't, from our grant perspective, really focused on that. Really, we were wanting to keep doors open and wanted to get telehealth up and running, but we're looking at what the next steps are. And so it's really that partnership that we are really focused on for the time being.
Thanks, Stephanie. Let's see, I'm going to go to Joanne next.
Yeah, I was just thinking about that question. I think some of it's the same. I think we're definitely very interested. No, I'll save that for last. I know a lot of work is underway about the thing we talked about earlier with the data and collecting data on patients and connectivity, and really how we do that, how we make it effective. So that work is definitely on the to-do list over at CCLAC that we're going to be working with the clinics on, continuing to refine and improve telehealth. Workflows, how it's occurring in the clinic. And right now, a big piece of that is the audio visits that we are still segue to our probably next conversation. That remains a critical piece, particularly in the behavioral health space. And so really, we do still have some policy work to do in the Medicare space around FQHCs and policy. One of the other big things we're working on in the land of FQHCs and it relates to the community health worker conversation, is the way we're paid, the way FQHCs are paid isn't really conducive to doing new innovative things and pivoting and turning on a dime. So we're still working on, constructing this alternative payment methodology, which would provide that flexibility that clinics need to respond to things like pandemics and to really pivot and adapt and give that additional flexibility so that they can, grab a community health worker and use them in a new innovative way without, needing to jump through a bunch of hoops at the state level. So that alternative payment structure that clinics have been working on for, it feels like forever now, a great many years, is getting closer and closer to fruition. And that's become a big priority because it really does, as we look at this future of healthcare, the ability to transform and innovate in how you're providing care is so crucial. But the on-the-ground work as well with the data collection and using that data and remote patient monitoring. I think we've just started kind of chipping away, scratching the surface with regard to how we can best utilize that in the clinic setting. So I think there's definitely a conversation to come around that.
Joanne, thank you so much. And for those of us who have know and love the alternative payment methodology conversation, that was a very nice, for those of you listening, succinct way of talking about a very important but also very difficult way of trying to modernize the way that we pay community clinics to make them more innovative. So thank you for that. I'm going to go to Charmaine, and then I'm going to have Dr. Nana take us home. So Charmaine, go ahead.
Great. Yes, thank you. I would offer that from an advocacy, policy, funding perspective, the sustainability to me really is going to need to be rooted in the belief and adoption and highlighting that this is truly a health equity issue, an accessibility issue at the core. Because as I think about health, the broader sort of defining of that is more comprehensive, right, than physical health. We've talked about the behavioral health piece, substance use, mental health, like all the things, social needs. And if we see that in that part of that continuum, then I think that's really going to help us from that advocacy perspective with our funders. Because I would say that, yes, we'll start to, we have data and we're going to be collecting data as a result of some of the grants that we have to help that initial telehealth, initiatives, but it's a matter of saying, well, then then what happens? Once that grant is over, like how do we leverage that? And I think it's right, like as Stephanie mentioned, for us in health services, it is going to be the most effective ways to partner with authentically our community-based organizations, our other county departments, because we're not going to, again, be able to solve all the issues. We're just going to need to be able to know, once we identify this need, how effectively and efficiently can I get somebody connected to the services that they need? And that's going to look different for each person that I'm working with, right? And so I think that is it. But key to that is us really just highlighting that this is truly a health equity and accessibility issue.
Absolutely. Thank you, Charmaine. What a great call to action for our health system and beyond, right? To really connect each other and connect, Big C connect through broadband to really get us moving towards achieving that equity. So Dr. Nana, please, last comments on this panel.
Yeah, I echo all what my wonderful panel colleagues are saying, as Charmaine, on about accessibility and how do you fix the gap of access, because one of the things that we haven't really talked about is, for those who are not insured, who aren't already connected to telehealth, right? When the moment we sign them up for insurance, it's about a 6 to 8 weeks waiting to actually get care. And that's a very fragile time for some communities that already distrust the medical system. They can go from, 50 to 0, like I'm not even about this, before they actually see a private doctor. So we're Shared Harvest sees ourselves in the future. We are a social enterprise. We believe that we're going to have our own self-determination of how we believe healthcare should be rolled out. And part of doing that is having a revenue driving component. And so we are just as much very vigilant about creating community clinical co-working spaces, so that providers can share resources, and those shared resources are giving them points towards their student loan relief. But that allows us to help with the capacity building. And in these shared resource spaces, providers are getting everything from business development support, helping each other with specialty referral services, talking about the mental burden of seeing their patients go through over and over, and then the challenges, and then shared resources for health navigators and caseworkers, because that is one of the greater burdens for the providers. It's one step to get on the telehealth platform and get to talk to your patient, but you got to get off there and do something, right? And that's all that, and all the people that you need to help you provide better service and better care are the things that we're still not talking about. And these were problems that were caused in health inequities before. So Shared Harvest is really razor focused now on the provider support and strengthening the medical provider pipeline, because we know that is what's going to solve all of its digital equity issues. When people see that they can sustain themselves in this space of healthcare, 20% of our healthcare workforce just dropped out. If they can't see themselves sustaining their work that they're doing, we're not going to get to equal care for anybody. And so that is Shared Harvest's mission 3-year plan. We have a project called Project Resus. It's resuscitating the healthcare pipeline. And we are razor focused about gaining $25 million in student loan debt relief to providers who are providing community health workers, telehealth ambassadors, and specialty services and mental health services.
Fantastic. Well, thank you all. As hearing you say this, the sky's the limit, and all of these possibilities are there, and just so excited to see where all of this is going to take you. So thank you all for our, please, I know all of you can't clap, but thank you all for an incredible panel. Really appreciate you all coming to speak with us today. I know I've seen some offline chat as well. It's been incredibly informative and inspiring. So thank you all. Thanks for doing such incredible work. I know we'll be working with you all offline on the back end of this. And if anyone in the audience would like to be connected with any of the organizations, these fabulous speakers, please let us know. We are here to help you do that. So thank you all. Really appreciate your participation today, and take care. As we let them sign off and bring on our second panel of LA County broadband experts, I'm going to invite Emily to put up our second poll of the day, and we'll do that while they're all pulling themselves up here. So if you can, please go ahead and fill out that poll real quick. And it's okay if you're not familiar at all with broadband, or if you really are familiar, we're trying to see how we should be plugging people in and the level of information we should be giving you. So this will be really helpful to us in our work today and our conversation that's coming up next, but also as we move on from this and launch ourselves into more broadband work on the back end. All right, we'll give it another 30 seconds and then we'll jump in. All right, let's close the poll and move on to our next panel. Thank you. Perfect. So we've got a nice mix of somewhat moderate, familiar, but a lot of folks also who this is going to be the first time they're engaging with this. So thank you all. All right. So I really was inspired by our last panel. It was really nice to hear sort of a deep dive on what our health system, everywhere from on the ground community-based organization all the way through our delivery system in our county and what they're doing in LA County. But I'm just so pleased to bring some colleagues that we've been working with through California Community Foundation's Digital Equity Initiative and have made these cross-sectoral partnerships. And it's just been such a pleasure and a wonderful time to introduce and make these connections. So I'm happy to bring them to you today. And with that, I'm going to introduce the director of California Community Foundation's Digital Equity Initiative, Shana Englund, who's going to talk to us a little bit about her work and then is going to moderate this panel for us. Shana, thanks for being here today.
Thank you so much for having me. It's fun to see familiar faces, and you'll see on my second slide recognizable logos, which is always fun. So yes, I am Shana Englund. I direct the Digital Equity Initiative at the California Community Foundation, and have the distinct pleasure of getting to work with these wonderful people also on the screen. So just very quickly, for those who aren't familiar with the California Community Foundation, CCF, it is the community foundation for LA County with a mission to lead positive systemic change that strengthens our communities. And the Digital Equity Initiative is a multi-year project within CCF with a mission to seed, grow, and support a digital equity movement in LA County with the knowledge and power to ensure fast, reliable, and affordable broadband is available for all Angelinos. And that is our website there. And just a little bit more about the Digital Equity Initiative. We are, as of right now, more than 35 organizations working in coalition to build and mobilize this movement to win on fast, reliable, and affordable internet for all Angelinos. And that means supporting projects like you're about to hear about. It means collaborating statewide and cross-sectorally around policy and raising up the voices and the needs of the communities that really have been left behind in the digital divide. We are centered on what, in our analysis, are the root causes of access disparities. And there is digital redlining, so there's systemic underinvestment in the physical infrastructure of how the internet actually works in affected communities. It is a broken market. We have a monopoly market. We have no choices. We have no market pressures for better service at lower prices. And really how the policy making has heretofore been captured by the big industry interests, whether you're talking about the state legislature, where there are articles dating back 15 years with headlines like AT&T is the most powerful force in Sacramento, and that kind of remains true, to kind of who participates at the California Public Utilities Commission, kind of all the way down the line. And we're working hard and so far very successfully in coalition to change all those things. And like I said, it is cross-sectoral. We have education and climate justice and housing and immigration and all kinds of things, but also really delighted to center health because it is such an impact and an important component of why it's critical that we address digital equity and the digital divide. So just some folks that you will recognize immediately, in fact, from 3 minutes ago, are part of our coalition, and we are thrilled about that. And I think I put our URL up there, and our My contact information I'll stick in the chat. But if we would love to include more and more health voices from across LA. And if you'd like to get involved, please get in touch with Katie at ITUP, as she's central to our work here. So with that, I will shush, and it is my distinct pleasure to introduce an amazing leader on these issues that we are lucky to have at the county, and that's Selwyn Hollins. Selwyn, I'll have you take it away.
Good afternoon. I'm really glad to be here and to share some information with you about what's happening in the County of Los Angeles relative to accelerating digital equity. First, here's a map of Los Angeles County. And in this map, you can see 306, it's estimated that there are more than 365,000 households that lack internet service. This data is based on United States Census Bureau data, the American Community Survey. And it's really important to keep in the forefront that a household consists of actual families and actual people. This map illustrates the percentage of households that lack internet service within different census tracts. The shades of color vary because in some communities, more households have internet service than other communities. The magenta colored areas are communities in which 20% or more of the households are without internet. Overall, in Los Angeles County, of the 365,000 households without internet access, roughly 150,000 are in the magenta colored areas. This is what we refer to as the digital divide target areas. You'll notice around the digital divide target areas a blue outline. And so that'll be referenced in subsequent maps. The map to the left identifies the annual median household income among census tracts. The red colored areas are communities where the median household income is less than $50,000 a year. According to US Census data, there are approximately 1.1 million households in Los Angeles County with annual incomes less than $50,000. This map also shows the blue outline digital divide target areas. Again, those are the communities where 20% or more of the households lack internet service. It's clear that the majority of households without internet are in lower income communities. The map to the right identifies the predominant racial group among census tracts. It also shows the blue outlines of the digital divide target areas. Based on population counts, most of the households without internet service are in communities with predominantly Black and Latino residents. On November 16th of last year, the LA County Board of Supervisors approved a motion titled Investments to Accelerate Digital Equity. The motion included several directives. Today, I'll be highlighting a couple of the directives that are really timely and pertinent. One of those is a countywide promotional campaign to educate and encourage constituents to participate in financial subsidy programs that will assist in the cost of computers and internet service, specifically the Emergency Broadband Benefit, or we refer to it as EBB. And the second thing I'll highlight is the demonstration pilot for community wireless networks that will provide free broadband access through public-private partnerships to 12,000 or more households in underserved communities. So an estimated 822,000 households in Los Angeles County were eligible for the Emergency Broadband Benefit. But at the time, the FCC data indicated that less than 45% of those households were actually enrolled in the program. The research indicates that enrollments are largely affected by a lack of awareness about the program. That being said, the county identified $3 million to fund the campaign, and ISD, my department, was assigned to lead the campaign through our Delete the Divide initiative. These were unbudgeted funds, yet there was an urgency to help get households connected to access essential services. Of this $3 million, roughly half of it will be for digital navigators. And so I'll touch on that a little bit later. For the campaign in December, we only spent roughly $200,000 of this $3 million allocation. Again, the board motion was approved on November 16th of last year, and during the following 2.5 weeks, including the Thanksgiving holidays, ISD partnered with the California Emerging Technology Fund to develop a campaign for the emergency broadband benefit. CETF is a nonprofit organization established by the California Public Utilities Commission for the purpose of advancing broadband access to underserved communities throughout the state. This partnership helped to ensure the consistency of promotional communications by utilizing existing statewide marketing models. The promotional campaign was a targeted multimedia, multi-language effort with support from the Board of Supervisors, 19 county departments, and numerous community-based organizations, school districts, medical agencies, faith-based organizations, and local businesses. And it's important to emphasize that what we did was leverage what already exists between our healthcare services and libraries and other public service and community-based organizations. They already have contact with many of the people and a trusted relationship of the people we're targeting who could benefit from these subsidies. The promotional campaign was limited in duration to only 3 weeks back in December because the EBB enrollment deadline was December 30th. So I'm just going to quickly go over some of what the multimedia, multi-language campaign included. It included TV ads in English, Spanish, and Chinese. So these are some of the images from those ads. We also had radio ads in multiple languages. We hosted a news media event to answer questions regarding the emergency broadband benefit, as well as the Counties to Lead the Divide initiative. Participants included reporters from television, radio, and newspaper outlets, including hyperlocal and ethnic media. Additionally, we had op-ed articles authored by the Board of Supervisors and press releases published in 38 targeted community media outlets. Ads were placed in various social media platforms, including Facebook and Google, and we also provided social media content to a lot of our partner organizations and community-based groups to share. More than 450,000 flyers and brochures were distributed in multiple languages. This slide shows some sample flyers with different family images catered to the particular population, and of course in different languages. We also have printed ads, again with different languages and different images that were placed in various news outlets. The combination of the different multimedia strategies resulted in more than 22 million media impressions, which is basically the number of times someone saw the marketing content. The impressions were generated from various sources. In addition to the outreach that I already highlighted, there were more than 113,000 text messages, 16,000 pre-recorded telephone messages, 17,000 emails, and the call center supported by the California Emergency Technology Fund received over 5,000 calls. Of the 22 million impressions, nearly 17 million were from media buys and generated over 3,000 calls to the call center. And then of course, this slide here just shows from the volume from different media outlets and how it resulted to call center calls. The 3-week promotional campaign also saw a significant increase in visits to the Internet for All Now website, which is where people can go to register. These efforts combined contributed to a 43% increase in enrollments in December compared to the prior month. So on December 31st, the emergency broadband benefit was replaced by the Affordable Connectivity Program. A couple of weeks ago, we launched a second phase of the countywide promotional campaign for the Affordable Connectivity Program. We're utilizing some of the same strategies that were successful in December. Plus, we're expanding outreach to include ads on billboards and bus shelters and digital navigator program. Again, our intent is to work with community-based organizations to hire individuals within the targeted communities. The digital navigators will be trained to provide constituents with in-person assistance in understanding and applying for subsidies, finding affordable devices, and technical support for accessing the internet. And it's important to note that there are a lot of existing programs throughout the county, but a lot of them are individual areas, locations, targeted populations. What the county is trying to do is broaden this so that it's across the county as a whole. The second directive that I wanted to highlight real quickly from the Board of Supervisors involves a community wireless network. The reality is, as we showed in the maps at the beginning, is that there are a lot of households that simply don't have internet access. The county is committed to improving the quality of life for residents impacted by the digital divide. We all know that a computer and reliable internet service are essential to accessing education, healthcare services, employment opportunities, financial resources, support networks, and commerce. The community wireless networks are intended to be a 5-year demonstration pilot that provides free broadband access through public-private partnerships. And in each instance or each area that we target, we want to be able to provide this service to 12,500 or more households. Since November of last year, we engaged in several efforts to develop a competitive solicitation to bring on one or more managed service providers to coordinate and manage the implementation of the networks. The competitive solicitation was released on March 21st of this year, and the deadlines for submissions is actually Friday of next week. After the submissions are evaluated, we'll create a short list of companies who are deemed qualified to deliver the community wireless networks. There are several requirements for the solicitation, including minimum data speeds. For example, the FCC recommends that broadband data transmission achieve a minimum download speed of 25 megabits per second and upload speed of 3 megabits per second. So we refer to this as 25/3. These recommended speeds are based on running one activity at a time, yet there are many situations that demand higher speed capabilities. For example, when multiple users or devices are accessing the internet simultaneously for web browsing, streaming video, file downloads, video conferencing, and gaming. This is common in many households, particularly in multi-generational living arrangement. So the speeds we're looking for our managed service providers is to be able to provide minimum speeds of 100/20 with the ability to scale up to 100 symmetrical. Also, this is very important, and this is one of the things we are reaching out to many partners, and the healthcare industry is definitely a partner we want to be collaborating with. We established an MOU with the City of Los Angeles, and we now have the Los Angeles County Office of Education also have signed on to that MOU. And pretty much it's an agreement amongst us to use our existing assets in a partnership to provide digital connectivity and internet access to communities. Typically, what happens is funding comes out from the federal government or the states, and we all compete for it. What we're doing is saying, hey, the benefit, if we pull our resources together, we can do a lot more. So we are agreeing to use our facilities, our radio towers, streetlight poles, other types of assets that we have in order to make this possible. And then digital navigators. Digital navigators we intend to use for promoting the subsidy programs, but also as we launch the community wireless networks, we want to utilize digital navigators. We've done some preliminary work where we've done some research. We've talked to a number of organizations and groups that are in this space. And the intent that we want to do is, as we hire the individuals from the communities, we would deploy them in 3 ways. One is obviously boots on the ground, talking to people where they are, door to door, in person. The second approach is to have events in communities, because sometimes people need to speak to somebody more than one time before they are reassured that this is what they'd like to do. And then the third approach is to ensure that we have call centers available. This is a sustained effort. It is not something that can be done one and done. So the digital navigators would be something that we would hope, to be honest with you, would go on for years to come and become a permanent service that's offered throughout the county of Los Angeles. And I'll stop sharing there and turn back to the group. Thanks.
Thank you so much, Selwyn. And I'm happy to pass over to another person we're very lucky to have working on this across the county. Amy, take it away.
Hi, sorry, needed to unmute. All right, so here to share a little bit about Unite LA and how we got involved in eliminating efforts to eliminate the digital divide, and share with you what we've heard also from the healthcare district or the healthcare sector. Can you all see my screen, by the way? Okay, great. So like many of you, when the pandemic started, Unite LA was not thinking about how to close the digital divide. It wasn't on our radar. And so it took disruption in what our core mission is for us to really dive in. So as you can see, our mission is to ensure the continuous improvement of effective and aligned cradle to career public education and workforce development systems in LA, resulting in all people having access to high quality education and living wage careers. And we do this primarily through direct programming. And we have a variety of direct programs, including college access programs, which have served over 300,000 young people between the ages of 16 to 24. 20,000 youth have been served through our job training and paid employment opportunities, and 10,000 high school students have been served through our career pathways programming. These outcomes were all a result of in-person programming. So at the outset of the pandemic, Unite LA began to explore what the effects of COVID were on our students, especially the students graduating from high school in 2020. Even before the pandemic, we found that 51% of LA Unified high school graduates were falling victim to summer melt. So many of these seniors have already applied, been accepted, and even paid enrollment deposits at a college before they graduate, but then they don't show up to college classes in the fall. And so when COVID happened, we saw this problem greatly exacerbated and disproportionately affect students of color, students living in poverty, and immigrant students. We turned to our regional partners, such as LA Mayor Eric Garcetti's office, LA Unified School District, LA County Office of Education, and numerous higher education institutions. And we decided to embark on a campaign that would help students stay on track to attend college in the fall. This campaign was called COVID College Connect. And it was used to get messaging out to high school seniors graduating in the class of 2020 on resources so that they would not fall victim to summer melt. One of the initiatives, or one of the interventions launched through the initiative, was an online inquiry form that we asked students to complete online to understand where they were in high school and where they wanted to be going for college. However, we only got 250 of 30,000 high school seniors to complete the form. With the goal of expanding the reach of COVID College Connect initiative beyond just those students who may have followed the mayoral briefings and those who had devices and internet access to complete the online form, Unite LA and the Mayor's Office turned to other partners, including the California Community Foundation, who had recently finalized an agreement with the USC College Advising Corps to offer college advising services to LA Unified seniors for free via a hotline staffed 5 days a week. And while we found that this was greatly improving senior engagement, it wasn't the only way that we needed to target students. So there were 3 other major strategies, and one of those strategies was to figure out how to provide devices to seniors who every single high schooler from LA Unified School District got a device to be able to do virtual learning. But if you were a senior, you had to give your device back in June as soon as you graduated. And so between June and the fall, seniors who needed to take specific steps in order to start classes, they needed to take steps online during the summer, weren't able to do that. So this led us to realize we needed to be in this game and to be addressing students and families that don't have access to devices or internet service. And then beyond United LA's challenges to serve students and youth to succeed in education and career, we of course heard the same news as everyone else about the effects of the digital divide on healthcare and economic opportunity and everything in between. And a report out of USC in March 2021 found that while most people are adopting the internet, adoption varies by income status, education attainment, and race and ethnicity, really demonstrating the inequities driving the digital divide. And that's really also another reason we decided to address the digital divide. And as Selwyn shared earlier, the US Census found 365,000 households without connection. And that to us is just unacceptable. Here comes the LA Digital Equity Action League initiative. So it is in January of 2021, the Unite LA board decided that eliminating the digital divide was going to be one of Unite LA's driving initiatives, new initiatives. And it is through a board member, Bill Allen, who's the president and CEO of the LA Economic Development Corporation, that we co-applied for the Regional Broadband Consortium designation to the California Public Utilities Commission. The role of an RBC is to seek state funding for broadband infrastructure deployment in underserved areas. Along with the partners you see on this screen, we designed the LA Digital Equity Action League, which we call LA Deal for short, to go beyond just that limited California Public Utilities Commission role. Understanding that it isn't enough to access broadband infrastructure. There needs to be affordable internet options, and people need to have devices and digital literacy to ensure adoption. So LA Digital Equity Action League is a collaborative, community-driven process to assess and tackle the broadband gaps that exist in communities across the LA region. We really focus on hearing from community, from civic leaders, from businesses, education, stakeholders, nonprofits, and government. So we really understand how this issue affects everybody holistically. And so one of the initial sectors that we convened was the healthcare sector. Back in April 2021, we invited, there were about 15 to 20 healthcare businesses to come to a discussion about how the digital divide was affecting them. And we found so many, we heard from so many about the amazing things that you all were doing to address the digital divide. You know, for clients who may not have the right device, for clients who don't want to go over minutes on service plans or not understanding how to navigate digital platforms, for clients not having a private place at home to receive mental and physical health care, and those who simply didn't have internet access. One company shared with us that in order to optimize telehealth, such as buying and optimize telehealth, they bought and sent low-tech tools so that clients could engage in telehealth. They started telephonic healthcare capabilities, and they provided training to clients about the care they were receiving. We also heard about how one healthcare provider deployed community resource hubs to provide virtual care for people in their communities. And we heard about another company who created a whole new full-time employment position, whose sole purpose it was to help people sign up for a vaccination appointment, which back then was done completely online. And one of my favorite innovations one company had was a student internship program where the student interns help patients download and understand how to use a healthcare app. Additionally, in November of this last year through March of this last year, LA Deal worked with the Southern California Association of Governments on a study Caltrans commissioned to understand how increased virtual remote options would reduce greenhouse gas emissions as a result of reduced vehicle miles traveled. One of the key sectors that one of the key findings was that 44% of respondents said that a lack of high-speed internet infrastructure in the region limited the number of employees who could work remotely and the number of patients who could receive services online. 55% of respondents from the healthcare sector responded that the optimal percentage of clients who could receive services online would be 60 to 100% of clients, and a similar percentage said the same about optimal percentage of their workforce who could work remotely. So this demonstrates that the healthcare sector really wanted to advance virtual and digital options for their clients and their workforce. And they said that one of the most helpful ways to get patients online or provide remote work opportunities to their workforce was to secure affordable home internet service and a device for them. And then they said that constructing high-speed internet infrastructure throughout the region so that all locations are connected was the second most important thing to do. You know, we would love to work with you all and engage and further engage you beyond, you know, those two kind of surveying and roundtable discussions. We have multiple ways to connect with you and would love to continue to, one, hear about the barriers you're experiencing, hear about the innovations that you've undergone that could be shared as best practices with your peers. And, you know, the way that you can do that is to join our monthly task force meetings. We have a task force that is around infrastructure. So how do we get more and better broadband infrastructure into the region? We have another task force around adoption, really thinking about the devices, the digital literacy piece, and the affordability piece, and how that plays into if people adopt or don't adopt internet. And then policy. So what are those barriers that prevent us from providing affordable internet access or deploying more and better infrastructure? And so we'd love to hear from you all during those task force meetings. We've had one-on-one conversations with your peers to learn about possibly exploring how we can use your hospitals and your infrastructure as an anchor institution in a broadband network in your communities. We also have a monthly newsletter. So this newsletter is really meant to share what is happening regionally in the state, across the country, in broadband. So if you are not sure about how to engage, it's a good way to just get your feet a little bit wet. And then join a task force meeting and be a fly on the wall. And then, you know, we can set up time to talk and really explore how we can partner more in depth. And then my contact information and our website are right here. That's it.
Amazing. Thank you, Amy. And our last presentation before we move to some discussion and questions, some incredibly forward-thinking, exciting work happening at Destination Crenshaw that Jason would love for you to walk us through.
Cool. Thanks, everybody. And I'm just going to grab the screen and then kind of dive right in. And I think really our organization is really trying to be a neighborhood specific model for the conversation and what everybody's talking about. There's a rare moment that we're in right now where the current conversation around equity is meeting infrastructure, which typically doesn't happen, right? Like infrastructure, those decisions are made in, boardrooms and, around coffee tables and donuts. A lot of times that doesn't make it to community meetings and people, really addressing their everyday needs. So what I'm going to talk about is how the Destination Crenshaw project is trying to approach infrastructure and then specifically go into equity around broadband services. So, over through 2020, we really saw, as we've heard, how essential internet access and broadband connection were for people in South LA. These are just two stories, but there were many of all publications of all types talking about how children, young people, everyone in LA needed access and needed it even more during COVID. There was also some challenges with our restaurant industry in South LA. A lot of people outside of our space don't know that we were going through a LA renaissance with the coffee shops, the restaurants, the things that we were really seeing in our neighborhoods popping up in 2018 and 19. And for those to really take a hit in 2020, we needed something to provide a way for them to actually move forward. And a lot of that was through technological advances, connecting to broadband, making their online presence more sustainable. And what we found is that our adoption rates that we found in South LA aren't necessarily due to connection, right? So you could be connected per se, right? Like you could have fiber to your house, but that doesn't mean you can afford to connect. And that's even before we had the pandemic. So now that these things have been exacerbated, that we've seen that our essential ability to be able to receive services has been almost stopped in a way. We need to really try to see if we can raise up not only the connection for young people and kids, as you see on this chart here, but all the people in CD8. And I'm focusing specifically on CD8 because that's South LA, that's where Destination Crenshaw is. So really, when we look at the lifeline of what it could be for us, we think about education, healthcare, of course, what we're talking about today, the workforce component, which I love that was talked about earlier, but also business and how we could create an ecosystem that revolves around digital equity as a lifeline for our folks and centering on broadband connection in our community. And so what is CD8? How do we make it up? It's 41% Black. It's a people of Hispanic origin, comprising of 50% of the population. This, one of the things that I really want to highlight is 26% of them have seen incomes go below the poverty level. So when we talk about infrastructure, this is a foundational need for a lot of people in this city. And this is not, like I said, a conversation of the privileged, right? Like this is how you provide foundational needs for people that need it, and understanding that it is essential to our education. 61% of the district has attained a high school education or less, right? So in order to have this, we need to actually move it forward to actually make sure that we could self-actualize, we could be self-determinant, we could actually move forward as a community. And really zooming in, right? And this is what I mean by access versus adoption, right? So we see that actually only 40 to 60% of, my catchment area, and these are census tracts from forgive my wonkness, but that's what I use when I look at things. But I think what this shows is that we think about how essential Wi-Fi means for our communities, for our businesses, for our residents. But to see that 40 to 60% of them are connected, that means 40 to 60% of them are not connected. Think about it in that way, right? Like, think about the people that are not adopting the service. And why is that? Why would you not adopt a service right now? I'm going to guess and say that's the cost. And what we're trying to address with Destination Crenshaw is a little bit of that, right? So at Destination Crenshaw, we see a 1.3 mile stretch that was the LAX Crenshaw line. And you see it here on this slide, and what we call the opportunity, right? Like, for once, we have a South LA community that is now they've got the door open to participating in an infrastructure conversation. My background is from River LA, 17 municipalities all over Los Angeles County. And when I heard about this, I really understood it from an infrastructure lens, but the community was talking strictly from aspirational hopes around permanence and what it means to exist in their community. And what you see here is the rail line. And what you don't see here in this rail line is dark fiber, which is very important. And I'll come back to that in a second. And so the opportunity is really to create this cultural commerce district around Destination Crenshaw that ties in pocket parks and community spaces, over 822 trees, public arts commissions. There's 43 Black-owned businesses along the corridor, 6 schools within a walking area of the corridor. All these things to essentially accomplish equity in space. And what I'm saying is that to accomplish equity in space, we also need to factor in the place-keeping opportunity of being able to tell this story at Destination Crenshaw, and being able to do that both on analog, but also digitally, And when I say digitally, I mean mobile. And that also means through our broadband connection and potentially providing free services. So what Destination Crenshaw is hoping to do is to be able to launch a digital equity zone along Destination Crenshaw's catchment area. And this is to pilot a digital equity program for the many communities along LA County, the city of LA, and others. It includes free Wi-Fi access for the businesses, the residents, the visitors to Destination Crenshaw to learn about our stories mobily, but also, check out who's having a sale at the store, or, to do, any of the things that connect people these days. Also provide free mobile devices and training. One of the things that I would push against during COVID was all these devices, right? Because the devices tend to add to costs that people have, but I essentially think that if we can turn the devices into a way to train people for the new career opportunities, that is a way for us to actually incentivize the participation, which is what I'm looking to do. And then, create an equitable infrastructure investment. How do we actually provide something that helps people support them moving forward? Because equity is actually the practice of making up for the disinvestment, but also overcompensating for that same disinvestment for the next 30, 40, 50 years. So I'll stop there, but I'm really excited about this conversation and would love to hear any questions.
It's always so hard for me at the end of these to not just sort of like, yes, it's amazing. There's so much great work happening. So I will just do that. Yes, so much good work happening. And I want to just start with inviting anybody on the call to please just voice questions in the chat, use the Q&A button. Would love to engage. I know there's a lot of technical information here that can sometimes make this conversation a little bit hard to access. So I want to offer a couple of factoids and then ask my amazing colleagues some questions of my own to spur some discussion first. So one factoid on this affordability question, you don't have to guess that the reason that people don't have subscriptions even where the infrastructure exists for them too, because poll after poll after poll says people say, I don't have broadband at home, or I only access broadband through my mobile phone because I can't afford it, or because what I can afford is at such low quality that it's not worth it for me to make the trade-offs I have to make in order to pay for it. So the affordability issue is huge, and is in fact connected to the infrastructure issue, because again, two things are true. One is that within the communities that you're talking about, Jason, also that I think that showed up as red in all of the ways in Selwyn's maps, there is lots of evidence of digital redlining where companies have not invested in upgrading infrastructure in those communities. And also on the affordability side, where they have, we also have kind of evidence, example after example, of where these companies actually price and have terms and conditions on their service that are much, much better in the predominantly white, high income, low poverty areas of the county than in the predominantly poor and or populated by people of color and immigrants. So there are some real systemic, demonstrable, and demonstrated inequities kind of built into these systems, that I love the kind of the approach of communities that we have to take responsibility for ourselves. We have to empower ourselves, not just to advocate for more and better and to support efforts like Selwyn's to bring us all universally more and better, but also for solutions that are really rooted within our communities, so that we can ensure that continues to be true. So the other piece that I think is really interesting is just the very clear kind of cross-sectoral. I think all of us have probably been on webinars like this one with like education folks, lots and lots of them with education folks, with like job training and workforce development. I was just on one with the immigration advocates who were talking about how their clients were in some cases getting like sentenced to jail time because they didn't show up to court appearances that were online because they couldn't get online to do it. And then of course, as we have heard kind of throughout this presentation and everyone on this call knows, all of the implications around equitable access to healthcare. And so I'm curious to kind of hear from the three of you, kind of with that in mind, what are the best ways, or what are the sort of low-hanging fruit, I guess, or maybe on the other end, hard but most exciting ways that we should think about more sort of fully integrating this health sector into this digital equity and broadband equity work?
I'll start it off. I think healthcare is one of the more essential things that everyone's always going to need. And we also know from our studies that in many of the areas where there's low internet adoption or service, they have some of the highest health issues. We've done those studies and we mapped that out. With the healthcare agencies, clinics, and providers, just being able to be a conduit for sharing information about how to get connected. It could be as simple as hosting brochures, hosting events where we can invite the community. Also from the assets perspective, when we do this community wireless, we need anchor institutions that are grounded and will be in the communities, for long periods of times. And many of our healthcare facilities are those types of anchor institutions. And from there, we can create these meshes, whether it's through fiber or other types of technology, to broaden it out to the community. That will create other opportunities. What's happening in many communities, you only have one provider. And so your options are extremely limited. And if you can't afford it, you do without. And what we're saying is, we can't allow that to happen anymore. People will say, well, why are you in this space? Well, I can speak from the county. We've always been in that space. We provide support for housing, for legal assistance, for medical care. Why not the internet? We do it for schools. So that's where we're coming from. But I think it can be done without a lot of extra effort by simple things. And we start off small. Like I say, just being able to be a conduit to pass on information is so key. And it's that effortless. So I would start with that. And anything else my colleagues would like to add.
So I would follow on what Selwyn says. I think that what we've heard just through our various engagements with different stakeholders is getting information about what's available, especially like the Affordable Connectivity Program, digital literacy programs. It's not as easy as it sounds. That the role of a trusted messenger is so important, because people come to these offers with a level of skepticism depending on who is providing that information. And healthcare institutions are trusted messengers, and I think and they're already in community, and like I know we heard from the last panel about promotora programs, but I mean that is essentially an opportunity to be a digital navigator and to provide those resources directly to community. So I would say, that's one really big way to engage. A lot of healthcare employers have government affairs offices, and I think policy is a really great way to engage, and because ultimately these are your clients that the digital divide is affecting. And there are tons of coalitions where you can be signers on support letters for different legislation that allow for more affordable plans, and remove some of those barriers that we're talking about. So I think engaging in the policy space. And Jason, I'm sure you have other things to add.
Yeah, I mean, I think it's essentially is like, and maybe it's because my father was a doctor, or is a doctor, from Tennessee in the country, and he would prescribe people a lot of times to go talk to somebody, and how we essentially treat that connection that can be made by broadband as essential. Like how do we make sure that everyone that wants to be connected to someone else can stop making it, kind of like a professional need, and really, kind of deal with the foundational use of it. Because I think the infrastructure part as a public good is why I love Selvon's work, right? Because ultimately, if Destination Crenshaw doesn't exist anymore, but the public good does what we do as a service, then that's better, because people are then represented, and they're confident about these things moving forward. And I think for healthcare, it is a lot of times how we actually humanize the profession and the connection to the people that are providing us the service. And that could essentially be whether it's a new platform, or it could just be a cheaper cost, to making that happen more often.
Thank you. We do have some questions coming in through the platform and in the comments, so I'll elevate those. This is a question for Selwyn. How can the community get connected to the Digital Navigator program?
So the Digital Navigator program we've actually designed a request for proposal that we are working with board officers on, because we realize not all communities have the capacity. Los Angeles County is massive, right? And some communities are more robust than others. And so the intent is to be able to help fund that effort through community-based organizations. But beyond that, because there is a cost to having people out there doing this work, we do have trainings and other things that we can offer to groups that already have that type of public contact. So whether they're a caseworker, whether they're with social services, whether with hospitals, we're working with LA Care right now. There are other ways that we can help just to get the message out. The digital navigators go a little bit further, is because let's say you finally, let's be honest, if you go into some communities and you want to buy a computer, where do you even buy a computer? Let alone, what do you look for if you buy a computer? Like some of us, we go and we look at an ad and we say, well, it sounds good, I should buy that. But a lot of people don't have that luxury. And so the digital navigators really help to ensure people make smart decisions. Or if they run it, how many of you have had a computer and all of a sudden it got glitchy on you? Well, in some of these communities, where do you take that computer? And so they're a constant presence. So I just want to point that out because digital navigators go beyond just sharing information. They really are people in the community that you know are always around if you need it, if you need that help. And there are other types of navigators that exist. Like there were navigators who helped people get vaccinated. There are navigators who help with education. I think as a county, we need to talk about a broader navigator program. And as things arise, you have this one source where you say, hey, I can go there and they can help me. So I would say to connect with us, I mean, anyone can reach out to me. I'm very accessible, even though I'm the director. I'm very engaged and involved. And so I'm hands-on. And so we can provide my email address and I can definitely help facilitate that. It's gonna take a community effort, private, public, community organizations. Everyone has to be in this if we're gonna make real impact and sustainable change.
Love that. And I think that might actually connect back, Amy, to your call to get involved in policy, because this sounds like something we might need to be showing up in support of budget for. So look forward to hear more about that. But we have another question I think probably like connects with at least Amy, your work and yours as well, Jason. ACP and Lifeline have provisions that make it really difficult to retain this benefit. How do we support retention beyond outreach and enrollment? And I'm going to take moderator's privilege to take that one further, which is there are actually really narrow qualifications. It's actually, and it can be hard to prove that you're eligible for those. And at least for ACP, this is not a permanent program. It is a benefit that has already been reduced from $50 to $30. And it has a cap of spending that so far there's not a lot of energy to improve. So I think this question of once we get people signed up for these benefits, what is the work that we do to ensure that it's not a temporary access fix? Whoever wants to go first.
I mean, I would just say, like, I think that's, especially for the community of Crenshaw, I think that's every single expense that we have, right? It's trying to figure out how do we slice and dice our budgets and make this thing work. And that's why we got to focus on workforce development, career pipelines associated with all these new things, and really evolving our job market with our commercial spaces. So it's a bigger question, right? But as the nonprofit lifer, I say philanthropy has a lot to do with that. We can close a lot of gaps if we understand the delta and we actually, present the problem to people that are interested in solving issues. I think that there is a conversation that is different today than 5-10 years ago, which is people are trying to solve things. I think if you present them plans that says, we have 200 folks, 30 of them can't pay this $20, I need $6,000, I bet you can get that. And I just challenge that, a lot of people, even if you're not in the nonprofit space, you start thinking about problems in that way and present them, because you can find, space in other budgets to kind of help people out.
That's a really great question that we haven't thought about at LA Deal yet. So thanks for elevating it. But I mean, policy. That's, I mean, that's the most obvious solution. But I also think that there is the ability to look at how you can blend and braid some resources. So like, I'm just brainstorming out loud. If, for example, a healthcare institution decided to be an anchor institution and provide a network of internet, they would be receiving those ACP subsidies that then they could provide internet service to the surrounding community or to their clients. I don't know exactly what that model would look like. We've been learning about a bunch of different types of models lately that are innovative and happening across the country. So would love to brainstorm. I think that that's a huge opportunity. Oh, and then real quick on the adoption, the digital navigator piece, the question directed towards Selwyn, beyond the county's digital navigator program, the state of California, the California Public Utilities Commission has a adoption account funding opportunity that will probably be released in the end of the summer. And it is really meant to support adoption activities, including digital navigator programs. So if any of you are thinking about, utilizing existing programs or launching new programs, I would encourage you to look into that.
So thank you for the questions. Thank you for the discussion. And on that last one, I would just say yes on policy, but yes also on some of the kind of more permanent, durable, low cost or free solutions that don't require jumping through hoops for subsidy programs in order to have something affordable. So both the work that someone's doing at the county, the work that Jason's doing in Crenshaw, and really to Amy's point, there is a lot of that creative work that's happening all over the county that could very much benefit from this sector's engagement to come up with those kind of durable, systemic, community-based solutions that don't demand things like subsidies for affordability. So thank you so much, Jason and Selwyn and Amy. As always, it's fun to share space with you. Thank you, Katie, for hosting us.
Absolutely. Thank you, Shana, for being such an incredible, capable moderator. And thank you to our fantastic panel, Selwyn, Jason, Amy. Just so inspired by the work that you do. And thank you for coming to share it with this health audience. And if anyone's interested in being an anchor institution, we'll absolutely let you know. but folks, you can start small with LA Deal's newsletter and learning more about Destination Crenshaw and what LA County is doing as well. So thank you all for such a wonderful panel today, and thanks for joining us. I'll let you all turn your videos off and join the rest of the panelists. We have one more poll for you now that you had a chance to listen to our incredible broadband speakers. Would love to hear if you feel more informed about what's going on in LA County. And again, if we can be of any help or interest, if you have interest in engaging with us in a subgroup of this LA Health Collaborative on this issue, learning more, getting plugged into each of these groups, we're happy to facilitate any of that. I know several of them drop their email addresses into the chat so you can connect with them directly as well. So thank you again so much. We'll let this poll go for just a couple more seconds, but really appreciate your time today. I hope you all are as inspired as I am. I'd say onward, the possibilities for this, for digital equity are endless. And so we're really excited to roll up our sleeves and get to work with all of you all. So thank you so much. Really had a wonderful time today. Thank you again to our wonderful moderators and panelists. And we will talk to you all later. Thanks. Take care. Bye.